Good morning, dear students. I hope you all have learned Unit 1, 2 and 3 well. Now let's move on to Unit 4. In that, compliance. The topic under Unit 4 is called compliance. In that part 1 we'll be discussing today. It comprises of complaints and evaluation of complaints. In the part 1 we are going to discuss about what are the complaints and how it is evaluated. So the content of today's discussion is complaints and evaluation of complaints. Let's move on to complaints. Definition of complaint is a statement. Complaint is a statement. Something is wrong or not good enough in pharmaceutical industry. And in pharmaceutical industry, it regards the quality of drug product. That means customer dissatisfaction about drug product. So it leads the quality of drug company also. So what are complaints? They are a statement. Something is wrong or not good enough in pharmaceutical industry, and it regards the quality of drug product and states about customer dissatisfaction about the product. Let's move on to the examples related to packaging materials and products. Complaints on packaging materials and products. Examples related to complaints on packaging materials and products. For packaging materials, we can find complaints like the bottle is leaking, the cap is difficult to open, the label color is fading, the tablet or solution color is different, and about product there is no effect, one tablet in the blister is missing, the tablet is broken. So these are the statements or as complaints related to packaging materials and products we could find as a complaint in pharmaceutical industry. What are the classifications of complaints? There are three types of complaints found: A type, B type and C type. A type complaints are critical complaints, where B type complaints are major complaints and C types are minor complaints. Critical complaints are adverse drug reaction, major health hazard causing permanent deficiency or death, purity and safety, potency, product stability. Major complaints are problem with primary packaging of the product, chemical or physical attributes of the product, extraneous contamination, mix-ups, etc. Minor complaints are problem related to labeling or coding of batch details, shortages, secondary packaging material problems, etc. So these are the types of complaints found in pharmaceutical industries. Let's move on to evaluation of complaints. So we have discussed what is the definition on complaint, examples related to complaints, and then classification of complaints under complaints. Now we are going to see about evaluation of complaints. Aim of evaluation is to improve customer satisfaction and to maintain company reputation. To improve customer satisfaction and to maintain company reputation. Let's see the mechanism of finding customer dissatisfaction. It involves two mechanisms: voice and exit. Voice and exit mechanism of finding customers dissatisfaction on either product or packaging materials. Voice mechanism involves customer do complaints directly. Customer do complaints directly regarding the product or packaging materials. Exit mechanism involves customer stops using products or services. Customer stops using products or services. So these are the two mechanisms finding customer dissatisfaction on the product. Voice and exit. Voice means customer do complaints, exit means customer stops using the product or service. What are the procedures involved in evaluation of complaints? There are 4 types of procedures involved in evaluation. First one, recall, then correction, then market withdrawal, then stock recovery. Under recall, F means removal or correction of a marketed product that FDA considers to be in violation of the laws it administers and against which the agency would initiate legal action. What is recall? A firm's removal or correction of a marketed product that FDA considers to be in violation of the laws it administers and against which the agency would initiate legal action. Example, seizure, formation of seizure. Recall does not include a market withdrawal or stock recovery. It has not included a market withdrawal or stock recovery. Is coming to the procedure called correction. The repair, modification, adjustment, relabeling, destruction or inspection, including patient monitoring of a product without its physical removal to some other location. Correction involves the repair, modification, adjustment, relabeling, destruction or inspection, including patient monitoring of a product without its physical removal to some other location. Third procedure is market withdrawal. It involves a firm's removal or correction of a distributed product which involves a minor violation that would not be subject to legal action by FDA or which involves no violation. Example, normal stock rotation practices, routine equipment adjustments and repairs, etc. This will cover market withdrawal. Then fourth procedure is stock recovery. A firm's removal or correction of a product that has not been marketed or that has not left the direct control of the firm. That is, the product is located on premises owned by or under the control of the firm and no portion of the lot has been released for sale or use. So these are the procedures for evaluation of complaints: recall, correction, market withdrawal and stock recovery. So with this we are coming to the end of discussion on complaints and evaluation of complaints. In the next class we will be discussing about complaints part 2. Thank you all for patient listening.